Hi, I'm Dr. Chad Larson. I do a technique called prolotherapy. Prolotherapy is short for proliferative therapy. So we use a certain blend of solutions into a syringe that we inject into joints. And this is a non-surgical joint regeneration technique where ligaments and tendons that are damaged, we can inject the solution into those tendons and ligaments, and it helps to regenerate and repair. And there's kind of two different components of prolotherapy. There's one called dextrose prolotherapy, where dextrose is kind of the active proliferating agent, and then there's PRP. PRP is platelet-rich plasma, and PRP is used, we use the person's own blood, we draw their blood, and then we spin it through a very particular process, and then we draw off the platelet-rich plasma, and we inject that into the joint. And whether it's dextrose prolotherapy or it's PRP, what it does is this blend of different solutions go into the joint, and they help to regenerate and repair the joint, because oftentimes when we have chronic pain in a joint, it's the nerves in the damaged tendons and ligaments that are telling the brain that there's pain in the joint. So when we could regenerate and repair those damaged ligaments and tendons, then that sends a signal, less of a signal to the brain that something hurts, so we could increase a person's function, and we could decrease their pain. So prolotherapy can be used for a wide variety of conditions. There could be old sports injuries where there's like a sprain strain that kind of went from acute to chronic, and now it's been there for months or even years. And so basically what happens with that is that the ligament or the tendon never fully healed. And so there's ways that we could inject that damaged ligament, and we can get it to tighten up. So old, kind of sports injuries, not even old, but even, more recent ones could be treated with prolotherapy. Degeneration, arthritis, ligament or tendon laxity, any kind of joint issue where there's pain and damage to the connective tissue, prolotherapy could be helpful to sort of tighten up those connective tissue structures and get that joint more sturdy and functioning better. The studies on prolotherapy indicate that it typically takes 4 to 6 treatments to really get that regenerative process happening. On any given treatment, there's multiple sort of injections that are done from different angles into the joint, and that's done about every 2 to 3 weeks, and sometimes even longer, some cases maybe a little bit shorter, and then that's done maybe 4 to 6 treatments. Some people need less, some people need more. It kind of depends on the severity of the issue. But typically what the studies show is that it takes about 4 to 6 visits, and then clinically that's been about my experience as well.